We're diving into a topic that affects millions yet often goes unnoticed until it's too late: stroke. Did you know that every 40 seconds, someone in the United States has a stroke? According to Centers for Disease Control and Prevention, nearly 795,000 strokes occur each year in the U.S. alone, and about 610,000 of these are first strokes. Let's unravel this silent threat together and enhance our health literacy regarding this condition, so we can better protect ourselves and our loved ones. First of all, let's understand the silent threat, and the question is, what is stroke? And what a stroke actually is? Well, neurologist Robert D. Brown explains, a stroke is a medical emergency that occurs when the blood supply to the brain is interrupted. This can lead to brain damage and, if not treated quickly, can result in long-term disability or death. Primarily there are two types of strokes. One is ischemic stroke, which account for about 87% of all strokes, occur when a blood vessel supplying blood to the brain becomes blocked, often by a blood clot related to high blood pressure or cholesterol buildup. And the second is hemorrhagic stroke. National Institutes of Health says that it happens when a blood vessel in the brain bursts, leading to bleeding in or around the brain. This type of stroke is less common but can be more deadly when it comes to stroke treatment. Remember, time is brain. The longer the brain is deprived of oxygen, the greater the chance of irreversible damage. American Heart Association in its journal named as Stroke says that every minute counts, with estimates suggesting that 1.9 million neurons, 14 billion synapses and 7.5 miles of myelinated fibers are lost each minute a stroke remains untreated. By developing awareness about silent strokes, those which go undetected initially, we can take critical steps towards stroke prevention. Now, let's talk about the risk factors for stroke. Some, unfortunately, are uncontrollable. These include age, as risk increases with age, family history, and race. Studies show that African Americans are at higher risk due to factors like hypertension and other cardiovascular disorders. But here's the good news. There are controllable stroke risk factors that we can manage. The very first one is high blood pressure. Harvard Medical School says that high blood pressure can double the risk of stroke. The second one is diabetes. National Library of Medicine says that diabetes increases stroke risk by 1.5 to 2 times, with risk increasing with diabetes duration. And the third one is smoking. According to American Health Association, stopping smoking reduces the risk for heart disease by half. It also lowers the risk for repeat heart attacks and death by heart disease by half. Additionally, quitting smoking helps lower the risk for things that can cause a heart attack. And here is the fourth one. We all know very well. Yes, this is living with a sedentary lifestyle or suffering from obesity. Hope no scientific evidence is necessary for this. So, high blood pressure we can control, diabetes we can control, smoking we can quit, and sedentary lifestyle is a choice that we can change slowly. Those were the factors we discussed, but recognizing stroke symptoms is vital for early detection. Remember the FAST acronym. F for face drooping. A for arm weakness. S for speech difficulty. And T for time to call emergency services. If you notice any of these signs, don't wait. Prompt emergency response is crucial. As we know, prevention is better than cure, so stroke prevention is key. Let's look at some strategies. It starts with lifestyle changes. According to the World Stroke Organization, regular physical activity reduces stroke risk by approximately 25%. Exercise plays an important role in reducing several stroke risk factors, including hypertension, diabetes, cholesterol, depression, and stress. Incorporate a healthy diet rich in fruits, vegetables, whole grains, and healthy fats while managing stress effectively through mindfulness and other techniques. This approach supports overall cardiovascular health. Additionally, medication can help manage risk factors, including blood thinners, cholesterol-lowering drugs, and blood pressure medications. But don't forget the importance of regular checkups. Routine screenings and consultations with a doctor can catch risk factors early, improving stroke recovery outcomes. If a stroke does occur, understand that recovery is a journey. Studies show that early rehabilitation can significantly improve stroke recovery outcome. Physical and cognitive rehabilitation, including therapy and assistive devices, play critical roles in helping patients regain their previous function. Support groups can also provide a sense of community during recovery. Emotional and psychological support are equally important. Many stroke survivors deal with anxiety and depression post-stroke. Studies indicate that about 1/3 of stroke survivors experience these issues. There are strategies to help you cope with these challenges and successfully live with the potential limitations caused by neurological disorders. So, where do you go from here? First, check out the resources of the National Stroke Association. Their website, hotline, and support groups provide invaluable medical information. Additionally, finding a stroke specialist near you can ensure personalized guidance for your health journey. Resources like the American Stroke Association's Get With the Guidelines program can also provide necessary insights. Most importantly, take charge of your health. Empower yourself with knowledge, it's the best defense against stroke. As Benjamin Franklin said, an ounce of prevention is worth a pound of cure. Educate yourself with health education on these topics for a healthier future. Thank you for joining me today. Remember, understanding stroke is the first step to stroke awareness and prevention. If you found this information helpful, please like, share, and subscribe for more health tips. Let's work together to spread awareness and save lives. Until next time, stay healthy and stay safe.